Hello, everyone. Thanks for joining us here on CBS News Atlanta at 11. I'm Jovina Fortson-Evans. As HIV diagnoses climb in Metro Atlanta, federal support is shrinking. The White House's new budget slashes more than $1.5 billion in funding for the CDC's HIV prevention programs. CBS News Atlanta's Madeline Montgomery shows us how the cuts are already impacting local patients and clinics.
Barry Sermons may not look like the typical student on Georgia State's campus.
I am a film and media major, and after 40 years of being out of school, I decided it was time to go back.
Why study film?
I want to do some storytelling, basically about the challenges in life.
One of those challenges.
I found out in 2003 that I was HIV positive, and I found that out by going to a health fair.
It was a free test that he was talked into.
Otherwise, I would have never been tested.
Free clinics continued to help Barry.
I was able to go see doctors, and I was able to get my medication. So those things really saved my life.
But now clinics that served HIV patients are losing funding due to federal grant cuts by the Trump administration.
We have roughly 18 to 20,000 people living with HIV in our Atlanta metropolitan area. There's different federal programs that provide free and very low-cost healthcare services that are, truly being on the verge of wiped away.
Dr. Daniel Driffin has seen the impacts firsthand on clinics and patients.
This turbulence within the system of being defunded, having money, the money being delayed, all of that ultimately creates additional barriers and it pushes people out of care for them not to be the healthiest that they can be.
Now people are unable to be tested, they won't be treated, they won't have the opportunity to become what they call undetectable viral load. And in order to eradicate the disease, we need the population to be tested and to know they have the status, to be on treatment and taking the medications, and then to become undetectable.
Barry believes there is still hope to get numbers down through connection, even with projects like the films he's learning to make.
We can take care of our own village. Now, we may not have the funding we need, but if we learn how to support each other and take each other along, then we can keep the virus and the spread at bay.
The CDC encourages everyone between the ages of 13 and 64 to get tested for HIV at least once. People with certain risk factors should get tested more often.